you doing today, guys? Are you in a good condition? All of you are in a good condition today. So today we're going to talk about the vocabulary that might be helpful when you talk about something related to hospital. Oke, jadi hari ini mirip-mirip dengan materi kita sebelum-sebelumnya. Hari ini kita akan membicarakan vocabulary or kosakata yang related to hospital, yang berhubungan dengan rumah sakit. Let's take a look to some vocabulary that might be helpful. You can see it on your screen, bisa kalian perhatikan di layar kalian. The first one, kita mulai dari top left corner. Kita mulai dari pojok kiri atas. So, the first one we have hospital. Hospital. Hospital is rumah sakit. Next, we have poison. Poison. Let's say it with me. Poison. Racun. Next, we have headache. Headache. Headache berarti sakit kepala. Headache. Next, we have Next, we have doctor. Doctor atau dokter. Next, we have sick. Sick. Sick berarti sakit. The next one we have gangrene. Gangrene. Let's say it with me. Gangrene. Gangrene itu adalah kematian jaringan tubuh. Gangrene, bukan gangrene. Tapi Oke, drug memiliki makna yang sama dengan medicine, yaitu obat. Next, we have injection. Injection. Injection itu berarti suntikan. Next, we have wounds. Wounds. Let's say it with me. Wounds. Diarrhea. Jadi bukan diarea, tapi diarrhea. Diarrhea itu adalah nama antibiotik, penicillin. Next, we have nurse. Nurse. Bukan nurse, tapi nurse. Nurse berarti perawat. Next, we have general practitioner. Practitioner itu adalah dokter umum. Next, we have surgery room. Surgery room. Surgery room itu adalah ruang operasi. Surgery itu artinya sakit, killer itu artinya pembunuh. Jadi, painkiller itu adalah obat penghilang nyeri, pembunuh. Get with me. Patient. Patient itu berarti pasien. Next, we have diagnosis. Diagnosis. Diagnosis itu berarti diagnosa. Let's say it together. Intensive care unit. Intensive care unit itu merupakan ruang rawat intensif atau bisa kita sebut ICU. Intensive care unit. Next, we have mortuary. Mortuary. Jadi bukan mortuary, tapi mortuary. Mortuary itu berarti kamar mayat. Mortuary. Next, we have syringe. Syringe. Let's try to say it with me. Syringe. Syringe itu berarti jarum suntik. Syringe. Next, we have diphtheria. Diphtheria. Diphtheria itu memiliki arti difteria. Let's try to say it together. Emergency room. Emergency room itu adalah ruang gawat darurat atau UGD. Next, we have medical chart. Medical chart. Medical chart. Medical chart itu adalah kartu catatan medis milik pasien. Next, we have infusion. Infusion. Infusion itu artinya infus. Next, we have numb. Numb. Restroom. Oke, kata ini mungkin kalian banyak lihat di mana-mana, terutama di tempat wisata. Well, restroom itu berarti toilet. Next, we have riverol. Riverol. Riverol itu berarti rujukan. Riverol. The next one we have virus. Virus. Virus itu berarti virus. Virus. Next, we have symptoms. Symptoms. Symptoms itu berarti gejala atau tanda-tanda, bisa juga wabah atau penyakit. Next, we have pharmacist. Pharmacist. Let's say it with me. Pharmacist. Pharmacist itu adalah apoteker, jadi yang meracik obat. Next one, we have cotton. Gauze. Gauze. Gauze itu adalah kain kasar. The next one, we have dysentery. Dysentery. Dysentery itu adalah dysentery. Next one, we have povidone. 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 Let's say it together. Povidone atau Lodin. Lodine. Next one, we have antiseptic. Antiseptic. Antiseptic itu adalah antiseptik. Next one, we have rubber hand. We have sterilize. Sterilize. Sterilize itu memiliki makna sterilisasi. Next one, we have stethoscope. Stethoscope. Stethoscope berarti stetoskop. Next, we have microscope. We have bacteria. Bacteria. Bacteria memiliki arti bakteri. Dokter bedah. Surgeon. Next one, we have swelling. Swelling. Nosebleed. Nosebleed itu berarti mimisan. Bleed artinya berdarah. Nose, hidung. Nosebleed, mimisan. Next, we have bandage. Bandage. Let's say it. Bandage. Bandage itu adalah perban. The next one, kita punya blood. Next one, kita punya dokter gigi. Kita panggilnya dentist. 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 Next one, we have scar. Scar. Scar itu adalah bekas luka. Next, we have matron. Matron. Bump. Bump memiliki makna yang hampir sama dengan swelling, di mana bump itu merupakan bengkak lebih ke benjolan. Bump. Next, we have fainted. Childbirth. Childbirth. Childbirth itu artinya persalinan. Next, we have allergy. Allergy atau alergi. Next one, we have cough. Cough. Sorry. Coma. Coma berarti sorry. Chickenpox. Chickenpox berarti cecerai. Chickenpox. Next one, we have cold. Cold. Atau pilek. Cold. Next one, we have crop. Jenazah. Crops. Sorry. Okay, so those are the vocabulary that we have to talk about hospital. Jadi itu beberapa vocabulary yang kita punya untuk membicarakan rumah sakit atau yang berkaitan dengan rumah sakit. Now let's take a look to the dialogue example. Sekarang mari kita lihat ke contoh penggunaannya dalam dialog. Okay, so here we only have 2 dialogue here. Let's take a look and practice. Okay, the first one we have the dialogue between nurse and Mrs. Sinta. Yep, let's dig into it. Good morning, is there anything I can do for you? Selamat pagi, apakah ada yang bisa saya bantu? I want to check my daughter's health. I will fill this form and pick up a queue number. Then, wait in the lobby until your number is called. By the way, your daughter looks as beautiful as you. What's her name? Okay, let's read it together. Form and pick up a queue number. First of all, you need to fill this form and pick up a queue number. Jadi bukan QWW, tapi Q. You need to fill this form. Kamu harus mengisi form ini, formulir ini, and pick up a queue number, dan mengambil nomor antrian. Jadi queue itu adalah antrian sampai nomormu dipanggil. By the way, your daughter looks as beautiful as you. Ngomong-ngomong, anakmu secantik dirimu. What's her name? Siapa namanya? Thank you. Her name is Nurita. Thank you. Her name is Nurita. Terima kasih, namanya Nurita. What a beautiful name. Please have a seat. What a beautiful name. Please have a seat. Wah, nama yang cantik. Silahkan duduk. Thanks. Sorry. So, a few minutes later, 3. Listen, your name is called. Let's meet the doctor. Listen, mari kita masuk ke ruangan dokter. But I'm so afraid, Mom. Daughter, you won't be alone in that room. Mom will always stand so close to you. Don't worry, my anakku yang cantik. You won't be alone in that room. Kamu gak bakal sendiri di ruangan itu. Mom will always stand close. Mrs. Sinta dengan anaknya. Okay, so that's for the first dialogue. Now let's move to the second one. Sekarang mari kita masuk ke dialog yang kedua. Okay, so in the second dialogue, ini masih berlanjut dari dialog pertama tadi. So now the setting is in the doctor's room. Sekarang settingnya atau backgroundnya ada di ruangan dokter. Okay, let's read it. Good morning, little girl. You look so beautiful. What's your name? Good morning, little girl. You look so beautiful. What's your name? Selamat pagi, anak manis. Selamat pagi, anak manis. Kamu terlihat sangat cantik. What's your name? My name is Ani. Anis Nur Afifah. Tell me what's wrong with you, Nurita. Fever and my throat is sore. I took some pills to bring down my fever, but this morning I got fever again. The temperature was higher than last night, doctor. Okay, I had a fever and my throat is sore. Aku demam. And my throat is sore. Dan tenggorokanku sakit. I took some pill to bring down my... Aku demam lagi. This morning my temperature was higher than last night. Pagi ini, suhu badanku lebih tinggi dari kemarin malam, dokter. Okay, open your mouth widely, please. Say, ah. Okay, open your mouth widely, please. Say, ah. Okay, tolong buka mulutmu. Membuka mulutnya, widely, lebar-lebar. Nurita, I think you got kamu punya sakit tenggorokan. Berhentilah makan salty or hot food, makanan asin ataupun panas. I love that kind of food, doctor. I love that kind of food, doctor. Aku suka makanan jenis itu, dokter. But those food are bad for your health. But those food are bad for your health. Tapi makanan jenis itu kurang bagus untuk kesehatanmu. Alright, doctor. I will do as your advice. Baik, dokter. Akan saya lakukan sesuai dengan saran Anda. Your advice. This is the drug prescription. Mrs. Sinta, ini resep obatnya. You'll have it at the drugstore. Kamu bisa tebus di drugstore atau di apotek. Thank you, Dr. Anis. I wish you to get well soon, Nurita. You can go back to school immediately. Saya harap kamu segera sembuh, Nurita, sehingga kamu bisa masuk sekolah lagi secepatnya. Thanks, doctor. I miss my friends so much. Di mana settingnya sudah berubah menjadi di ruangan dokter. Tadi Nurita katanya terkena demam atau fever dan juga sakit tenggorokan. Tugasnya adalah try to find a partner to practice this dialogue. Jadi coba kalian cari hari ini. If you guys have any question, kalau kalian ada pertanyaan, please make sure to take a note. Tolong pastikan sudah dicatat